Good morning. It's 11 a.m. in Boston, and you know what that means? It's time for Woke Women Wednesday. Senator Dianne Wilkerson here with you this morning. I might not sound so cheery for the entire 30 minutes I'm going to be with you, but yeah, I'll walk through and explain why. But I always start the same way. You know that, and that is to say thank you to the women with the vision to know that in these times, which began for me in May of 2020, just a few months after the introduction, unwelcome introduction of this thing that we knew as coronavirus. But these women had an idea and they had a vision, and they said, well, you know what? It's important for us to have an online live uh, radio show, Facebook Live, WWOC radio, so that we could bring information to people in a timely fashion. And boy, do we need it. So I say thank you to the women. I come to you every Wednesday at 11 a.m. and at 8 p.m. on this same Wednesday, Woke Women Wednesday, my fierce and fearless colleague, citywide city councilor, Julia Mejia, she closes it out at 8. And so join her tonight. She's going to have one of the many Boston city council candidates. We have a municipal election in September. It's important. And there are many people of color running, and I think it's important you meet them. But I do on Wednesday morning, I come and talk to you about all things. So I say black, brown, black and COVID, right? Which really means everything and anything, because we've never had a loss for topics to discuss, because COVID has invaded every single aspect of our lives. And today will be no exception. It's going to take me a little bit to get to Boston. I talk every week about what's happening with Black and Latino residents in Boston in the context of COVID. And they said there's so much conversation. But to do that today, I'm going to start with what's happening around the country. I won't even deal with around the world, but because if your eyes are fixed on Tokyo, you know that COVID has creeped in, not creeped, really, I would say like just bogarted its way in a major way to the Olympics, impacting the United States team, impacting other athletes. It's now, the NFL, in fact, in the United States, the National Football League has a policy on COVID. Um, and that last year, you recall, they forfeited some of the teams forfeited games and individual team members contracted COVID. Well, this year, going to be a little different. They are going to forfeit games and have to forfeit the money that goes along with it. There's going to be a policy restriction and penalty, like loss of pay, for NFL players who choose not to be vaccinated. And so that's operating out there. That's real. The state of California has, in the last week, because of the explosion, and it's appropriate, I think, to use the word explosion, in new cases, mostly driven by unvaccinated people contracting the Delta variant, although be clear, there are vaccinated people contracting COVID-19 as well. But they are dealing with a spike and an outbreak in California that has resulted in the reinstatement of the mask mandate. The city of St. Louis has reinstated their mask mandate. Uh, I'm trying to think New York. How can we forget? So the mayor of New York City announced policy this week with respect to public workers, city workers, which means the people who pick up your waste on a weekly basis, to the police officers, to the city hospital, public hospital workers, to teachers, will be required to document that they've been vaccinated or be subjected to a COVID-19 test on a weekly basis. And obviously, if you are conducting tests on a weekly basis and you test positive, you won't be working as a waste collector, public works, city teacher, fireman, police officer at all. So long way to say, as the kids say, this is getting serious again. Although we knew it because we've been talking about it all the summer, about pre-summer, what would happen if we don't do X. We didn't do X. And now we're beginning to see the ramifications of not having done X when we should have. But more than that, the CDC, which the Center for Disease Control, many of you may know, we see that word so often. 2 weeks ago, I mentioned that the Surgeon General of the United States Surgeon General, who happens to be from Harvard, Boston area, and announced he issued a statement. Issued a statement. I read it. It was about 20 pages, a rather long statement you consider for a Surgeon General, but he issued a statement, really a warning. It could have had like the red skeleton, skull on the front of it. Would have been even more appropriate and clear about what this was all about. He issued a statement, a warning of what was coming. And he, of course, based on all the information and data that they have, which is enough to make your head spin, that he knew exactly what he was talking about, because what he warned about in the statement he issued is now kind of at our doorstep. And we're seeing the spikes, and that's what it's called, spikes all over the country. Outbreak on the Cape in Yarmouth. Again, another nursing home facility that had more than 30 residents, I think all of whom had been vaccinated, contracted COVID-19. Provincetown has reinstated a mask requirement and moving rapidly towards a requirement that you have to document vaccination or would not be allowed into various places and venues in Provincetown. They're not playing because their outbreak, they've had some 400 plus people tested positive in Provincetown since the 4th of July weekend. Okay, and we're still in July, so that's not a long time ago, and that's a lot of positive tests. Martha's Vineyard, kind of the summer haven for so many of you who I know are looking and watching at this moment, has had now this steady um, uh, uh, number of people testing positive for the Delta variant. But of course, why not? Just like Martha's Vineyard is a haven for so many in Boston, it is for so many, particularly Black and people of color from around the country. So people are coming from all over the country to the Vineyard on the summer. And so there should be no surprise to anyone that they're experiencing, because of the different policies in place in different cities and states around the country, should be no surprise that they're experiencing an explosion. So you begin to see restaurants, both requiring masks, and we are moving rapidly towards the place where we will see a requirement for documentation of testing. The CDC, I started to mention, the Surgeon General issued statement 2 weeks ago. The CDC issued amended mask guidelines on yesterday. Who could be surprised? So they are now saying, as official warning, that people, even folks who are vaccinated, should be wearing masks inside. Right? Wow. 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 This week, we've seen interviews with doctors in Alabama, who has the worst rate of vaccination in the country, which of course means the highest spikes. That now the exploding, numbers in terms of hospitalizations and deaths. I saw a doctor from Alabama who was interviewed, and she was talking about what's happening with her patients, young, 20. She talked about a 20-year-old mom. 20s, in their 20s, in their 30s, but she talked specifically about a 20-year-old mom that she was caring for last weekend, and over the weekend, and came in Monday morning to hear that the patient had died. She talked about what's happening with the conversations that she's having with the young people in their 20s who have contracted the virus. Didn't think it would ever happen to them. Kind of ignored all the conversation and made decisions. Oh, no vaccination, and of course, contracted Delta variant. And one thing we know about the Delta variant is just more virulent than the previous. So it'll take it. The impact is more devastating. It happens quicker, and it's taking them out. So the patients are literally about to go on the ventilation. Usually a bad sign, and for many, the last step before they die, and begging the doctor, can you please just give me the vaccination? And the doctor saying to them, it's too late. Once you get to this point, the vaccination is too late. It's not going to help you. And so there it is. That's just, I say the national story. Talk a little bit about Boston. And I say Massachusetts because despite the fact that that Massachusetts happens to be one of the states, like many, no exception, that are seeing the um, spike in the number of new cases. Yesterday, I believe I saw the number 12 was the largest number of deaths in one day that we've had, largest number of positive cases that we've seen on yesterday. So it's here. And so all of that, I say all that to say that given what we know, given what we see, given what we see happening right before us, why are so many people just so dead hell bent, as they say, on moving on and living life and pretending like in fact things are better and that we're good and it's time to move on? I think that there'll be scholars that will study the psychology of COVID response for years after you and I are gone. But what I see right now and what you're seeing right now is some psychology on a whole new level that is where your mental clock, I think, is just turned off and said, I'm done. I don't want to be isolated anymore. I don't want to be afraid anymore. So I'm moving on. Like in our minds, they'll say, I'm moving on. I'm moving on, although things aren't better. Things are getting worse fast. But and I'm talking about adults. I'm not even talking about children because they take their messaging cues from us for sure. You and I all know that last summer we were all in lockdown. So, parents who spent the summer of 2020 in the house with children with nothing much to do, we had just kind of had been visited. I say, and we knew it. We knew coronavirus and soon to be COVID-19 in March, and by June it had taken over our lives. And so parents had no time to plan for a summer. So we spent the summer last year in lockdown. And so many parents just decide, I'm not doing that this summer. I'm getting out and I'm going to get the kids out. So what's happening? Sending the kids off to camp. Have you been watching what's happening? Like literally camps shutting down, right? Shutting down, like sending kids home because they have no staff, because their staffs, they've not been able to recruit. It's just not working. They've had, COVID outbreaks. So you think, oh, we'll get them packed away and they're going to be off in overnight camp and they'll be good for the summer. And then in 3 or 4 days, you get that call and saying, camp is shutting down, we're closing it, and the kids are on the way. The other thing that they're having problems with is that because the staff shortage is so widespread, they're not doing the kind of vetting that they would normally do in hiring summer camp staff. And so the kids are complaining, oh, this person doesn't know what they're doing. They've had really abusive treatment by some of the staff. And so major, big camp, upstate New York closed this week. And the parents went scrambling once again, what to do with the kids. So here we are in Massachusetts. And I mean, it's fast track to Boston. And all around you, you're seeing signs. It's like spring. I continue to raise that vision of the scene in The Wizard of Oz when the house falls on the Wicked Witch, and remember the toes curl under, and then the sun comes out, the munchkins and all, and then people start opening the doors, and Dorothy and the Scarecrow and the Tin Men, everybody looks out, the sun, the flowers are blooming, and they say the Wicked Witch is dead. And so we can come outside. They start singing and skipping and dancing. And that's the vision in my head. That's where people are in their mind. Except guess what? The Wicked Witch isn't dead. She's not dead. She's not dead. She's still lurking around every corner. And we got to figure some things out. So, I may say something that I'm going to say pisses some people off or offends some people because people are serious about the pretense that we're in. They want to pretend that things are okay. So we decided just to move on. So now we're having big events and we're excited because, there's 1,000 people attended this one, 2,000 people attended this one, 3,000. I'm watching the pictures on Facebook and my heart's palpitating because I'm afraid for what is going to come of this. Second week last night, second Elma Lewis Playhouse. I'm like everybody else, I'm like, I want to be there. I want to see it. I didn't go last week, didn't go last night. I know it began to rain, poured down rain last night, and people got washed out. I saw that as God telling you, didn't I tell you? Are you not paying attention? This thing is real. You can't have gatherings of 3,000 people, not when you're sitting next to each other. There's no social distancing. You all cheek to cheek, taking pictures cheek to cheek and smiling and happy and, touching skin to skin. Hold on 1 minute. I got to turn the sound off. But that's what we're doing. Sorry about that. That's what's happening. And the city of Boston is a sponsor for the Playhouse in the Park. So I'm trying to figure out what kind of message, like, everywhere we look, we're getting mixed messages. Stay home, continue, stay out of big crowds, continue to social distance. But by the way, we're having an event tonight, and I encourage you to come, right? Like, what are we doing? What are we doing? We lost a family member this last weekend in Massachusetts, right? In Boston, to COVID, passed. Another grandmother. And so I know that it's still real. I think that many of you know that it is. You just decided, you know what, I can't take it anymore. I'm moving on. Well, mm, mm, mm. It's getting worse. The governor has, he's watching it. He's doing the brave face. Oh, I'm just continue to be careful, and I'm not going to change any of the policy or mandates or restrictions in Massachusetts for the time being. Yeah, okay. Why not? Because remember, he had also said he wasn't going to impose any requirement for statewide mask wearing, come school. And I used to say September, but you all know there's some of our schools that they start in August, right? Um, and so that message is going to be important. What does that mean then? That where our children are really getting ready to begin a third cycle, because we did 20, we did 21, and now we're going into 21, 22. Our children are getting ready to start a third education cycle in disarray, where the number of parents who are doing um, uh, homeschooling has exploded. Not just white parents, black parents, Latino parents as well, because the risk to the children's health is so great. And not to mention the teachers. We talk about school, and we always mostly we talk about students, but there are teachers there, there are administrators there, there are people who are legitimately concerned about their health. So how do you plan? You're a parent. How do you plan for September? What is going to be the policy in Boston Public Schools, which 82% children of color. So it impacts us greatly. It impacts us more than it does anyone else. Excuse me. Well, what do? If you're a parent, you're concerned. You start the plan for another school year for kids doing remote learning, and then dealing with the isolation that remote learning then brings with it, because that's what's happening. But we don't know. I know that 2 weeks ago, the mayor announced that they were going to require masks in Boston Public Schools, and you saw the outcry. Up, oh my God, who are you? This is my freedom of speech, my rights. You don't tell me what to do, and and then the requirement got a little less strident and stringent. So not clear still what's going to happen in September. But here we have it. We have it, Boston. And so in the context of all of this, there's this little army of people, and I'm proud to be among them. I would say proud, who have been completely focused on what do we do, what kinds of things can we do to keep our people safe and to save lives. We now have 20, I think, colleges, universities in Greater Boston that have imposed vaccination requirements. What that all means in terms of the scramble, we'll see. Students who wish to return to a campus existence. I know that these college students have to be a little mind stir crazy as well. I wouldn't blame them. The college life was a big part of the whole college experience. And yet in the last 2 years, solid years, they haven't been able to really to enjoy it and appreciate it, and may not really be able to do it this year either. But just asking people to hold tight. That's all I say all that to say, hold tight. We focused on the Boston neighborhoods we are focused on the Boston neighborhoods where we're seeing a slow response to the request for vaccination. So we're doing better, in Roxbury, 02119. We're doing better in Dorchester, 02121. We're doing better in Dorchester, 02125. But something about that darn Mattapan, we cannot seem to get it together. And so all of the organizations that have been focused on addressing, fighting, providing information for COVID-19, advocating for testing, right? Don't know where you are if you're not testing. I get I'm testing every other week now, just because I need to know. If I'm moving around and around folks, some of whom are telling you they're vaccinated and they're lying. There's no shortcut word for that, right? So you want to be tested as well. And so you're always on the lookout for those places that are still doing testing. But something about Mattapan. And there are many theories about it. I heard somebody say yesterday, well, it was X% of Haitians, like this is a Haitian issue. Nope, not. If you think about it, Boston, that Mattapan has always been kind of like that community that everybody treats as if they got it. They don't need anything. They get less attention because it's like that middle child assumption that they're all right. You got the one who is ADHD, and you got the one on the other hand who gives you trouble. But that middle child, she does her homework on time, and so we don't have to give her as much attention. That's how I would describe the relationship with Boston and Mattapan. When in fact, and why? Because they actually do have the highest homeownership rate in a community in Mattapan. So it's not about low income individual. That's not what's happening. I think it happens to be just like it's the farthest from the city, a seat of government downtown at City Hall. It's next to the line in Milton. They do have a disproportionately high number of homeowners. They have a disproportionately high number of people from the Caribbean, but that doesn't explain it all. I don't know why my nose is itching. I think there's probably somebody can tell me what that means when your nose itch. I hope it's something good. I'm talking to the older mamas. You know what that means. Tell me what it means when your nose itches. But so Mattapan, after all that is happening, is at 40%. The goal is to get the city of Boston to at least 70% of the residents vaccinated. Mattapan is at 40%. Roxbury's now in the 58, 55 percentile. Much of Dorchester is there as well. We've got some pockets, in streets and neighborhoods where they're low, but every neighborhood in the city is up well past the mid 40s into the 50s, and some as high as 70s. I'll tell you, our senior population, they did what they needed to do. They're like in the 80% vaccinations, right? But Mattapan, 44% for the community that we call Mattapan. And for Black residents of Mattapan, it's 40%. It's the lowest in this. In fact, I saw the number yesterday. It's like 39.85. That's a concern. Why? Because it's summertime and folk of color like to be outside. That's the bottom line. They like to be outside. You know that. I know that. They like music. They like to party. August is literally this weekend coming around the corner. It's Caribbean Carnival month. And so, by the way, there will be the Carnival celebration, which will happen in place in Franklin Park. There will not be a parade as we know it for 2021. But yeah, it's not bad. It's not good. And we don't have an answer. We don't have an answer. Yeah, we don't have an answer. We got to figure this out. We got to figure it out. I want to see the beautiful pictures and the smiling faces and the kids having fun outside. But I know the reality is that in order for that to be safe, it's going to take us a minute, right? It's going to take us a minute because it's not safe to do it. I tell you, I know from personal experience, I lost another family member this weekend to COVID. If I wasn't clear the first time, complications from COVID. Um, think about it. Think about these children who, are losing grandparents, have lost grandparents in this last year. The Black Boston COVID-19 Coalition, of which I've been privileged to be a part of, is doing a virtual event on Saturday, August 7th at 4 p.m. And I'll post on Facebook as well. But we're going to have Reverend Dr. Gloria White Hammond and Dr. Basola Ojukutu. If you have not seen Dr. Ojukutu, you should, because on September 1st, she will become the new executive director of the Boston Public Health Commission. Harvard trains, teaches Harvard. She is a physician of infectious disease at Brigham, Mass General Brigham, and an expert. I'm so excited because I can't believe that the city of Boston bagged her, right? This is going to be the new executive director of the Boston Public Health Commission. But on Saturday, August 7th at 4 p.m., we're going to spend an hour. They've just given you an update. So I talk about the numbers and the impact, but I'm not the medical professional, and I don't give medical advice. I tell you what I see. I can tell you what I read, but nothing better than hearing it directly from the experts. Dr. White Hammond has been on the ground. She's, been in many of the events that we've been doing where we've had vaccinations, and so she's done vaccinations. So in addition to providing, like I said, that solace, I say, for the soul, she's a medical professional, medical doctor. And so we're going to have Reverend Liz Walker, who is one of the governor's members of the governor's vaccine task force. So those three sisters, and we're hoping to have our chief of Health and Human Services on with us as well, Marty Martinez, and to talk about where we are. So you can hear the facts. You can hear medical professionals talking about what's going on, because that's just the most important, to hear it from them. And so just watch Facebook. You'll see the information. You'll see the flyer for the event, the Zoom link, and you can get on a phone. You can call in and listen. But we need to know. We need to get an update on the facts. What is happening with this Delta variant? What's happening? What is a Lambda variant, which is a whole nother name that is out there? How do you get to be a variant? What does it mean? Are they worse than the original COVID-19 virus? Is it better? What's happening? So listen to physicians, medical professionals will talk to you about that piece. Not us. We don't. It doesn't have to be. We want you to get information from someone who is reliable. Why? Because it's that time when you start to see people making decisions about going back to school, about going back to campus. And the reality is, from what I already have been told, listening to these experts, don't be surprised if we are finding ourselves in another official lockdown, because this spike is real. Massachusetts is in it as well as everybody else. Boston is in it. You can see by the numbers if you're reading the reports. There are neighborhoods where it is more prevalent than others, but the bottom line is that, I think the CEO of Apple, I saw today, Google and Apple are expressing concern about the Delta variant may knock us down again in a big 1-2 punch. And yet, we have that urge, like I said, the urge to be okay. And what's happening is I think we've just decided we're going to pretend that it's okay, even though it clearly isn't. Like I said, I could tell you I get it, but actually I don't. But I understand it. Understanding it and getting it is two different things. I understand it. I understand what I see. I see people who want desperately to be normal again. My thing is I don't I don't think normal was good for Black people in the first place. So I have the least desire to get back to where we were, because I think we deserve better. And we only get better when we do better. So we can deserve better, but unless we do better, not going to make a big difference. I'll have a guest next week, because you'll find out soon who that is. But I try every other week. Just sometime I use my 30 minutes, this precious time, just to talk and share what I know. And what I know is that as much as we are trying every day to present this normal face, the smiley faces, and it's not good. We are not doing well, as they say, we're not doing well, and this thing is going to hit us like a ton of bricks in the next 2 or 3 weeks. Mark my word, you're going to see it. You're going to turn, because the ticker clock went away. Remember, every day on TV, they were showing us how many people were hospitalized, how many new cases, how many deaths. And then for a month or two, they just stopped. You notice something? It's back again. I saw it yesterday, saw it 2 days ago, but it should be back, because I think we're visual people in general. And so we only believe it when we see it in front of us. And then sometimes we still don't believe it. But the count is on again. That's not a good sign. It's not a good sign at all. When doctors tell you that they feel like it's surreal, that we're right back where we started, that's not a good sign. But that's what we're seeing and hearing. And so I just want you to be safe. I want us to be safe. I want continue to wear your mask when you're, obviously outside. Even if you're in a picnic setting where you're sitting with people in in the beach chairs, have your mask on. If you're within that 6 feet or sitting cheek to cheek, and that's what I see, the pictures where everybody's smiling. We should be wearing a mask. Actually, now, as of yesterday, you've read what the CDC is saying. You should be wearing a mask inside. So that's definitely a step backwards from where we were, but that's real. So wear your mask. Physical distance is still important, not social distancing, but physical distancing. Grove Hall, Prince Hall, Grand Lodge, right in sunny downtown Grove Hall, they're still doing testing and vaccination on a daily basis. The National Guard is doing the vaccinations. The Black Boston Coalition, COVID-19 Coalition, in conjunction with Harvard Street Neighborhood Health Center, City of Boston, they are doing the mobile van. This Saturday, that van is going to be in Franklin Park, because we were there last week, so 2 weeks ago. So we have to go back so we can do the second vaccination for the people who got that first one. So if you're driving around looking for some place, Playstead Park, the entrance for the zoo, you can always find the mobile van there on most every Saturday. And we're going to we have a very busy schedule for the month of August, from Blue Hill Avenue to the Garrison Trotter Neighborhood Association event to the carnival will be in the park on the 28th on that Saturday. We're going to be at Gospel Fest on Sunday, August 8th. And wherever else we're needed, we'll be there, right? We'll be there. No Books, No Balls was gracious enough to allow us to be in the space. Thank you to Tony Richards for really having the wisdom and the insight to allow us to be there to provide vaccination and testing for the hundreds of children 12 and over and their families who want their kids to be safe, because that's really all we want. It's about safety and saving lives. So until next week, I bid you a goodbye. Stay safe. Remember, 8 p.m. this evening, my colleague, City Councilor Julia Mejia, will be with us on WWOC, Woke Women Radio. And we'll see you next Wednesday. Have a wonderful, safe day. Bye-bye.